Hi, I'm Pat Bartley Danielli, and this is the Graduate Nursing Program Selection Keys to Success. I am the Nursing Education Program Advisor and teach in the undergraduate and graduate nursing program at the School of Professional Studies, CUNY. I am a doctorally prepared nurse and board certified as a family nurse practitioner with specialty certification in critical care, perioperative nursing, and perioperative ambulatory nursing. Next slide. This presentation is being supported by the Department of Nursing at CUNY School of Professional Studies. We are an online program for both undergraduate BSN and BSN to MSN seamless option, where you can have your associate degree and continue on with your for your master's degree. In the graduate nursing education program, we offer a Master's of Science in Nursing, and for those who already have a Master's in Nursing, we have a postmaster's certificate. What we are looking at in terms of the School of Professional Studies is that we have 3 tracks in the graduate program: nursing education, nursing informatics, and nursing organizational leadership. Our academic director is Dr. Margaret Riley, who is also an advanced practice certified nurse and doctorally prepared. And you can certainly see she has other credentials. Next slide. So I'm really happy to see the turnout for this webinar because it means that you're exploring, well, what's the next step? And why do you want to earn a degree at the graduate level? I think it's really, really important, and it goes back to your undergraduate education, where development of a registered professional nurse at the undergraduate level that is finished at the baccalaureate level, you are a generalist. Certainly, we can talk about how the clinicals and the content was divided. You were able to take care of patients from all age groups and specialties. But now you really need to consider for graduate nursing education, nursing in terms of program selection as to where do you want to specialize. So certainly to enhance your professional knowledge, you will develop a nursing expertise, and that will definitely be very reflective of the major in terms of your program selection. And as you transition in your career, it will open up opportunities for you, especially in the specialty role that you are considering as a master's prepared nurse. Next slide. Well, let's just talk about graduate nursing program options in general. As mentioned before, the master's or MSN is traditionally a master's in a specialty, and in the next few slides, I'll go through the specialties. Traditionally, with a nurse having a baccalaureate degree already completed. As mentioned before, you can have a master's already in a specific specialty, but have decided that you would like to have more expertise in an area that that interests you, where you want to combine the educational preparation maybe for a current and new role. Doctoral degrees, you can see there's a lot of alphabet soup with the doctoral degrees, but we will certainly talk about them. The doctorate of nursing practice is a clinical practice doctorate. It really initially started out for the nurse practitioners, but it certainly has expanded to include other roles. So again, we are trying to really support you in your consideration and application to grad school. And again, there's a lot of things to consider before you even apply. But there is the option that you can, from a baccalaureate degree program, go straight through for a doctorate of nursing practice in multiple specialties. There are some issues in New York State with the DNP, where it is limited to only nurse practitioners, but there are national programs that are DNP, clinically focused doctorates, that not only include the nurse practitioner role, but also include roles in nursing leadership in particular. The PhD, the DNS, and the EDD, again, many alphabets. These are considered the research doctorates. Certainly incorporates many of the concepts of a DNP, but does require a dissertation. Often I would say to you, instead of getting caught up in the letters and the initials, that a PhD, a DNS, and an EDD often reflect the school's affiliation with the department for the graduate program. So an example could be a Columbia, who has an EED because nursing at the graduate level for their program, say as a nurse educator, is under the School of Education, but they all are equivalent. As I mentioned before, you can go straight ahead, and from your bachelor's, if you truly am looking to be a doctorally prepared nurse, you can have choices in terms of a DNP or a PhD straight from a BSN. Of course, the program is going to be longer. Well, what is important here, and I really want to emphasize this, especially in relationship to how difficult it has been with the COVID pandemic, and I'm sure many of you, as myself and SPS, have been affected by that. There is a new IOM report, The Future of Nursing, and it really calls on nurses to have partnerships and interdisciplinary collaboration. And in order to do that, you need to be a specialist and a graduate prepared nurse in terms of graduate education. Next slide. Oh, I don't know. Yeah, okay, that's it. Sure. Next slide. Sorry. Oh, wait a minute. Let's go back. Go back again. Let me make sure. Okay, next slide. Sorry. My computer blipped. Well, you're here now. You may have already applied, or you're considering applying to a graduate program. One of the things I certainly will say to you, look at what the program delivery options. Many of the programs developed an online education in an emergency because of what happened with the COVID crisis. But there are differences in terms of the language. So when we refer to synchronous online delivery, there is a designated period of time where the class is in session online, and there is interaction with the instructor at a designated period of time. Asynchronous is the online program delivery at sps.cuny, includes what we use as Blackboard, and there are certainly specific deadline due dates within each week, and also assignment due days, but you don't have to be online as a designated period of time. An example for us would be that there's discussion board postings that are reflective of the weekly materials and resources and topics that we're discussing. And traditionally, the students post on a Thursday, and then they need to respond by Sunday at midnight. So you can see there, you have the option then to meet the deadlines, but they are at your time of convenience. Of course, there's the live option in terms of the traditional classroom where you attend class. And I would again say to you that all programs now are incorporating online education. So even if you choose a program that is live in terms of class option, there is a good chance that there will be a hybrid or a combination of online and live learning experiences. Again, when you start to explore your options for graduate education, be aware that not every school offers every specialization. So as I mentioned before, SPS.CUNY has leadership, nursing education, and nursing informatics as the specialties currently in graduate nursing education. There are other programs that may not have those specialties, and when we get to later to other slides, you will also see that within the specialties, they are subspecialties. So it is really, really important before you apply to reflect on your goals and aspirations for where you are and where you want to be, and to apply to the program that offers the degree that you're interested in. Cost, well, certainly in terms of cost, there's a wide range between public, private, and for-profit institutions. And again, I won't make up assumptions, but I certainly could say that if some nurses are working full-time, they have either tuition reimbursement or tuition remission. So again, before you even apply to a program, find out the logistics from your organization as to not only, first of all, can you afford the school, but second of all, if you do have support for tuition remission or reimbursement. And again, there's logistics with that. There are often scholarships that you can apply for to supplement your payments. But again, I can't say I can go through the specifics on that because they change, but those are all things you need to consider. When you also talk about cost, you also need to realize that some schools accept part-time students, some schools have only the option of full-time students, and you'll see that in doctoral programs particularly. So again, before you apply, of course, think about, look at the money, as I say, show me the money, and look at what you're able to afford, explore your organization's policies in terms of cost and reimbursement, and that will guide you in terms of the fact, is this doable for you? In terms of time, again, I think that reflects what I mentioned before. We all live very busy lives. We all are working, and as I joke often with my faculty colleagues, I have a student working every minute of every day. There are so many shifts and patterns of the students and their employment that you need to think about carving out the time to engage in the program. So again, think about what you're looking at. See, in terms of when you look at the timeline, definitely look at completing the program in less than 5 years, because knowledge does become old. And in addition to that, you want to have the current knowledge when you graduate. Now, learning styles. Again, this really goes back in terms of when you learned patient education in the undergraduate program, and how does a patient or a family learn. What I am talking about in terms of online education may not be it for you. It may be that you like the structure, the communication, the interaction with your colleagues in a live setting. Of course, a lot of things have changed because of COVID. And the students in an online program are extremely independent in them being able to complete their assignments, asking for clarification. We have excellent supports for online education in CUNY with the help desk, but without a shadow of a doubt, I would say that the CUNY students are very proactive and engaged. Another consideration is to look and see, are they accepting new graduate nurses? And again, because some of you may be new to the workforce. And in addition to that, look and see if there is any information in terms of the admission policies. So, for example, there may be a limit on the number of seats or vacancies that they can accept. Some schools only offer admission in the fall, some only offer it in the spring. And there's also programs that accept both in the fall and the spring. For those of you that are out of nursing nursing education in terms of your program for a while, there is no doubt that the nurses are looking to complete their program in a timely fashion. So there are opportunities, not in just the traditional fall and spring, but there's opportunities in the summer, and in some instances, limited opportunities in the winter, depending on the school. But there are semester breaks, there are holiday breaks, but you need to be aware that you have options in terms of being able to go through the program seamlessly on a 52-week calendar that does have breaks in between the semester. Another consideration, when you talk about a specialty role in graduate education, you are talking about the nuts and bolts of clinical practice. So again, explore, look at the websites when you are applying and see if you are receiving assistance for the practicum and clinical placements for your graduate nurse specialty, or if that responsibility is your own and the other parts of, say, the course and the practicum, say the content, are supported by the school, but the actual selection and finding a preceptor may heavily weigh on the students. So again, I emphasize these are all things that you should do before you even apply. Again, at SPS, we have a practicum for each specialty, and we do provide assistance by the program for practicum placement. Next slide. So let's talk about personal timeline. So your personal time, you're really in control of your personal timeline. And I would say to you, because I have read multiple applications and been involved in decision-making processes for graduate applications, that the best application is usually the one that is developed over time. There's certain parts of the application that are a matter of logistics, where you want to make sure transcripts get there. But again, start early. The deadline for SPS, the priority deadline is April 7th, 2022. And the regular deadline is May 17, 2022. So you do have a little bit of time, but you definitely have time to start. Okay. You do need to meet the application deadlines, basically because there is what we refer to as onboarding and orientation, so that you can be successful in your program. I can't speak to the specifics of every application, but really think about developing a timeline for the development of a personal statement and editing. And this doesn't necessarily mean that you have another nurse to edit your personal statement or give you recommendations, but you really are looking at a reflection of where you are, what your personal and professional goals are, and how graduate education will support them. It is important. Things that students may stumble on can be grammar or very long convoluted sentences, but regardless of that, often it's time. If you reflect on what you've written and go back the next day and edit it and have someone else look at it, you will see things that maybe you didn't see before. And again, you want to really focus, because remember, anything related to the to a personal statement really is the foundation of why you apply to the program. I know this sounds simplistic, but it is very important to follow the directions for the personal statements. And if they do ask for evidence-based projects, make sure you follow the guidelines. There usually is a few sentences there that can assist you in terms of writing a pertinent statement, or again, if required, an evidence-based project. It could be both, it could be one. I would say to you that every time you look at the requirements and what you need to submit, reflect on where you were and what were your contributions to that, say, evidence-based project, or contributions as a staff nurse, say, in a community health center, and then be able to provide examples to show that your role has grown and developed in your clinical practice. Something you could do today: review your current resume, update it, make it succinct. Another recommendation is, you are very surprised at how it is much harder to write a short personal statement. Usually they're not more than a page or page and a half, and a synopsis of an evidence-based project, or a resume that's not 15 pages, because that is not a resume, but really to highlight both your current clinical practice and also highlight your candidacy for the graduate nursing program. Next slide. So what happened? Back again. Okay. So a few things about the graduate application timeline. It's not one and done and submit and then just wait. You need to log in, check, and follow up. Often you have relationships with your references, your professional nurse references. They're excellent clinicians or leadership nurses that you interact with, to find out that those professional references were not submitted. So again, check, give a little nudge to the colleagues that you have asked for recommendations. Be very clear in terms of who you select. So for example, and again, it's only from my experience as a reviewer, professional references from another, say, staff nurse would not be acceptable. It would definitely be a leadership person in nursing that would support your ability to do well in the nursing program. Another important, and again, it can really delay the application processing, is the transcripts. Many students have multiple entries into undergraduate education. Some actually have baccalaureate degrees in other fields. Some students may have been in school, then got interrupted and changed their major to nursing, but had had an allied health degree or another or other credits that were applied to a degree they're no longer pursuing. It is extremely important that all transcripts are submitted for review. Remember, we are looking at CCNE, which is our accrediting body, which is from the American College of Nursing. And we have to make sure that you have the supporting courses to be successful in the graduate nursing program. So all of your transcripts in college must be submitted. And that being said, make sure you check your application that they have been received by the admissions department. Next slide. Here is just a picture of the CUNY application, and you can see where it says future students. So there's tutorials and resources there. You can go in and save your application and go back. That's why I definitely emphasize the importance of reflecting on your personal statements, your resume, checking grammar, spelling, and that way you have everything reviewed and edited before you submit the application. Next slide. One of the things that I mentioned before, and this will be the foundation in terms of your decision for graduate education, is your role specialty. As I mentioned before, SPS has Masters in Nursing Leadership, Nursing Education. That includes both staff development, as you know, in the clinical setting, or professional development is the other name that's used for that, and nursing informatics. So when you talk about nursing informatics, it's truly nurses that are involved with the development and design of instruments and online mechanisms that plan, implement, and evaluate care. In addition to that, there is a strong relationship between quality improvement with informatics, because we are definitely looking at outcomes. We have many colleagues in information technology, but they may not be nurses. So certainly things like workflows, checklist, all of those things are supporting the expansion of a nursing informatics role. I am a nurse practitioner, and I can tell you that you need to be very, very careful in your selection of your graduate nursing program in terms of nurse practitioner. The American Association of Nurse Practitioners and AACN has certification for the specialties. So again, depending on your interest, the first big decision you have to make is, am I looking at a primary care focus versus an acute care focus? Not every program offers all the specialties as a nurse practitioner. So an example I can give you is there is certification as an adult geriatric nurse practitioner. The certification involves certification in either primary care or acute care. It is a dilemma in nursing practice, because the thoughts are that if you are educated and certified, where you've taken the certification exam in that specialty, that you should stay in the setting to practice as an advanced practice nurse. That again being said, you need to think very carefully. There are programs that may only have primary adult geriatric nurse practitioners. And therefore, you are applying to a program which may not support your current or your future goals. As mentioned before, I am a family nurse practitioner that focused on all age groups in a primary care setting. The roles, my clinical practice roles, really combine both acute care and primary care. So that was an exception, but it also was based a little bit on my previous experience as a nurse. But I would say to you that it has become stricter in terms of what the role expectations are. So the first thing is decide whether you're looking at primary care versus acute care. Again, what your interests are. Are you interested in certain specialties? We have women's health nurse practitioner, pediatric nurse practitioner, which could be acute or primary care. We have a women's health nurse practitioner, which is definitely more primary care. So before you even apply, make sure that if you are applying to a nurse practitioner program, one, that it prepares you for the national certification exam, and two, to make sure the population focus and the setting is where you want to go to support your goals. Other advanced practice roles include the clinical nurse specialist. There are less programs for that. That is an advanced practice nurse, and I will use the common one that I think we're all familiar with, and they have different names than what I'm saying, but the wound and skin care clinical nurse specialist is an example. We also have oncology clinical nurse specialist. So you can see there, well, what's the difference between a clinical nurse specialist and an NP? Well, an NP, and it does, because I don't know if there's people here from other states, but it is based on state guidelines. In New York, we have the right to prescribe. There are what we call collaborating relationships and collaborating agreements with physicians. And again, that is beyond the scope of this presentation. While the clinical nurse specialist has a focus of an advanced practice nurse, as I said, for example, oncology, and she would be involved with program design, patient education, interdisciplinary coordination for the patients, but will be limited in terms of prescription privileges. Other roles that are important to consider are the certified nurse midwife. Be very careful. Again, there are different state regs. Currently, CUNY does not offer a certified nurse midwifery program. Many of the students go to Columbia. But again, if you're looking at online learning, you can certainly explore outside New York, but you do need to be careful because there's a high clinical requirement in terms of hours, and that then may get difficult logistically if you are located in another state other than the program that's being offered. In addition to the nurse midwife, there also is a certified nurse anesthetist program. Again, this is a collaborative it is a program that has a foundation in collaboration with an anesthesia attending physician. It has a large, very large clinical requirement. Both the midwife and the clinical and the nurse anesthetist, often you will see that they are only taking full-time students and do not recommend working during the program. It is very specialized, very limited, and very highly selective. But again, you have to look at what your goals are. For the clinical nurse specialist and for the certified nurse midwife, they certainly are expanding options now where a nurse can go from a baccalaureate to a master's or from a baccalaureate to a DNP or doctorate of nursing practice. Okay, so I'm sorry about what happened to the slide. But now we're going to open for questions because that's what you're here for, and whatever we can do to facilitate your decisions, the better. So I'll take any questions.
There's one question in the chat, Pat, about recent clinical nurse specialist programs, and if you could share some.
There is a clinical nurse specialist program in the College of Staten Island. I would definitely say to you, it is best to explore the website. Many of the clinical nurse specialist programs will, you will attain a graduate nurse specialty as a clinical nurse specialist, and you and the faculty will develop the experiences to support the specialty. So again, those are areas that need to be expanded. And as I said, I wouldn't say that I know all, but the one that comes to mind is the College of Staten Island. What are the options for the BSN to DM and how we apply? Okay, so again, I would suggest, remember that although this is a CUNY sponsored event, I would suggest that you go on to the American College of Nursing and look, and you can also type in master's degree nursing programs or DNP nursing programs. You can do it by state and look to see what programs are there and click on the website for that. I would tell you that my experience is that this is now an expansion to go from the BSN to the DNP. So again, look at what the options are and make sure that it matches what your goals are.
Hi, I have just one question. How soon can we start application process for the MSN program for leadership?
You can do it now. The priority deadline is April 7th, and the regular deadline is May 17th. Just
Okay,
go on the website, you'll see it, and you'll hit admissions, and it'll have all the information, and you click, and just like the slides, you'll see the CUNY application. And remember what I said. It's probably best not to do it all at once, but to do it in sections so you can reflect and edit. And the big thing, follow up on your references, follow up on your transcripts.
and how do we in place the connection between and HHC hospital and this program? How do
Say it again.
there's an affiliation between the HHC hospitals and your program,
Okay.
CUNY program. How do we in place that so that we can be a priority in terms of the application process?
There is information on the application asking.
Oh, it's there.
Yeah.
Okay, thank you so much.
Yeah, the information is there. I will definitely say to you, and again, this is personal, not professional, but I am a Hunter Bellevue graduate from the BSN. And then I received my Master's of Education at Hunter Bellevue. And then unfortunately, there were not FNP programs that were postmaster certificates. So I left CUNY and went to PACE. And then after that, I went back to CUNY for a cultural competence graduate certificate at the College of Staten Island. And then, believe it or not, because I'm not that young, I needed an online option to complete my doctorate because of my clinical responsibilities as a nurse practitioner and my family responsibilities. So I completed my doctorate at the University of Nevada, Las Vegas, and attained a PhD in nursing ed. So other than the fact I feel like I spent a lot of my life in school, remember to look at what your goals are and how to meet them. The biggest thing is, remember that graduate education is specialty education. So you really need to reflect and make sure that the program is a match for your short-term and long-term goals.
Hello?
Hello, Dora?
Yes, can you hear me?
Okay. Yep, I unmuted you.
Oh, okay, great. No, only because I was driving and I have the mic on. So I just wanted to ask, I know that CUNY used to have the PhD and doctorate program. Will
Yeah.
that ever come back, or is it completely gone forever?
No, it will come back, but I would say to you that I don't think it's coming back for fall of 2022.
Okay, so it would be more like for 2023?
I can't say that.
Oh,
I don't see any. I actually looked on the website today to see. One of the things with the CUNY PhD program, I think that's what you're talking about,
yeah,
is that they do require full-time enrollment. So,
yeah,
you know, I'm not saying that that is not doable, but you know, you need to kind of carve that time out. And it is very difficult to work full time with that, you know, with being, you know, as I said before, the certified nurse midwives and the certified nurse anesthetists, I've had a lot of interactions with them in clinical practice, and they had to give up a few years of their time in terms of clinical time as a nurse, and maybe work a little per diem, because the amount of clinical hours that are required are extremely large. If a nurse practitioner program, and I have a feeling it's going to go up, but you're looking at 750 to about 1,000, even more hours, and those are regulated by accrediting agencies.
oh, because I'm already a nurse practitioner, and I've been a nurse practitioner for 11, 12 years already.
Mhm.
So I was looking for just the doctorate, a PhD, not really the DNP, but more of a
Okay.
PhD. So when I originally, before the program shut down, I did go for the open house, and they said they had all the classes were on Friday. It was full time, but it was only on Fridays.
Mhm.
So, I mean, if it stays that way, it's completely doable for me, even working full time.
Well,
So,
as I said, I actually checked the website before the, you know, to get the most current information, and there are no applications for fall
yeah.
of 2022.
Which is sad, because really that was really one of the only programs I could honestly afford. I
Right.
can't afford any of the other programs, you know,
Mhm.
and I work for a city hospital that doesn't really reimburse you, you know,
Mhm.
enough. So
Mhm.
for me, it's just unfortunately not worth it.
But you also
But
may want to look into online options for the DMP, because there are definitely schools outside of New York that you can get a doctorate with already having a master's. I can definitely tell you that. But it requires a little bit of digging. So that way, but again, be careful, you know, in terms of like the on-presence requirement. So again, for myself, we went every August, the first week for 1 week to get orientation and stuff like that. And then after that, we were back a day, and then I had to go back on campus a few times, say maybe 5 or 6 times throughout the program, to do my defense and my proposal and things like that. So, you know, you know, depending on where it is, that involves money for travel, which you, again, may not be reimbursed for. But there are programs, you just need to do a little digging. What is the name of the program you had mentioned? SPS? Is that a question? We are the School of Professional Studies, part of CUNY. I see that question. Most programs require a BSN. Most BSM to FMP or DMP are fall admissions. All CUNY and FNP programs. Are there non-matriculated courses we can take in the meantime? Yes, there are. And I would like to use my hospital's 2022 reimbursement. You can certainly start off as a non-matric. And you can take the courses. There are non-matric applications that are part of each university's options. My one caution to you would be that some institutions will not, meaning your employment may not reimburse non-matric. They may only reimburse if you are enrolled in a program. But those are things, again, you need to check. All right, let's see. Did I miss any other questions? I'm looking here. Ooh.
I think just the most recent question now.
I'm
Pat.
looking.
So there's Estelle and Rachel down at the bottom.
Okay, Estelle and Rachel.
Marietta.
All right, Estelle, is there a doctorate in nursing informatics? Yes, there is. It is the DNP, or you can go on it for a research doctorate in terms of a PhD. Again, you'd have to really explore each website. I would definitely say that the DNP for the degree, it's a little touchy, because if you live in New York, currently DNPs are restricted to nurse practitioners. If you apply to an online program outside of New York State, you will get a doctorate of nursing practice in that specialty. And it is a credential, it's an academic degree and a credential, and it will be part of your role in New York. But because of this DNP issue in New York, they currently do not offer DNPs outside of nurse practitioners. We have faculty on it and in SPS who are DNPs in nursing leadership that they attained outside the New York. So it is possible. And again, I'll tell you, because I've been doing this a while, that this is all evolving. You know, when we first developed the PhD, it was definitely looked at in terms of evidence-based practice, really looking at publication and implementation of studies. And when the DNP came, and again, it makes sense why the NP programs went towards the DNP initially, because you're looking at clinical practice and being an expert and an advanced practice nurse in a clinical specialty. And again, not just related to nurse practitioner. But I will tell you that it is evolving, and certainly in my clinical roles, it has become very difficult sometimes because the lines are not so clearly defined. So again, I'll just use myself as an example. On all the QA projects that I was involved with, and I'm an educator and developing education programs for NPs and all this, I could not do that alone without nursing informatics and nursing leadership. So the specialties are important in terms of your role, but you will often see there is an overlap in terms of the fact that we all kind of need to work together and have joint initiatives, in particular in clinical settings. As for the Leave-In FNP program, my understanding is there is a site visit shortly, and that there are addressing accreditation issues. So again, you can check the website, but I know there were issues, and I think it's best to leave it at that. They actually had some dates listed as to when the visitors were coming. Okay, so Yvonne wrote, I would like to enroll in a program that would allow me for primary care for all ages, but would I be able to transition from acute care with this? Okay, so again, remember what we said. You have a clinical specialty in acute care. That's what it sounds like as a nurse, and you're baccalaureate prepared, I'm assuming. But you are looking at taking care of primary care in all ages. That is a family nurse practitioner, without a shadow of a doubt. I would say to you, and again, this is not everyone's philosophy, but the more you diversify your practice, the more valuable you will become. So it is not uncommon for a nurse with acute care experience deciding that they want to expand their role as an advanced practice nurse, say nurse practitioner. That would involve the family, which then translates into all age groups. Again, if it is a family nurse practitioner, education is at the primary care level. There is not any acute care FNP programs currently that I am aware of, and I'm pretty familiar with that, but you certainly can transition into a different focus. Remember, there is a large clinical requirement. So even when I went to school, and the regs haven't changed that much in terms of clinical specialty, that would mean that your clinical experiences and practicums would have to reflect all age groups. So that's where you would develop that specialty specialty as a family nurse practitioner.
There's a few earlier questions from
Okay, let me see.
Marietta and Rachel.
Marietta. All right, Marietta Malloy. Rachel, I haven't seen any. Oh yeah, I talked to Rachel. Was the question that I know CSI has a clinical nurse specialist question, a program. Rachel mostly CUNY.
And then Marietta about evidence-based practice project.
Okay, what questions do you have about the evidence-based practice project? First of all, the application may not require that. That happens to be an SPS requirement. But usually it may, and again, you have to review the application requirements. They may ask you to talk about a quality initiative in your institution, but I would definitely say to you, the key to writing anything successful in terms of personal statement is be able to reflect your current role, what contributions and advancements have you had in your career, and how does that support your specialty interest in graduate study?
Okay, good evening. So I'm actually in my second semester at SPS. I had spoken
hello.
to you. How are you?
And are you undergrad, hon?
Yes.
Oh, good.
But I
Start
already,
early.
yes. I had spoken with you before because I hold a bachelor's in hospitality and
Right.
associate in nursing. So I'm in the middle of completing the application because when I spoke to the academic advisor, she mentioned, to apply sooner than later to the program. The BSN.
And what are you applying for? The BS to master's?
Yes, the nurse educator.
Oh,
education. Yes, the nurse education. So my question was on, I was trying to figure out what the evidence-based practice would be, the project would be. Would that be?
Okay, so I can give you a few examples because I think many of us are have been saturated with this. An example would be if there was a quality initiative at your organization on falls for older adults. Were you involved in the initiative? What was the parts of the initiative? What was the reason for it? And that's usually some sort of statistics that there was an increase in falls. And what was your contribution and evaluation of that project? That would be an example. At SPS, one of the courses, one of the ending courses has an evidence-based project. So if you're applying sooner, you may have to look at your clinical roles, because I'm not sure, how many semesters are you into SPS? How many
This is
semesters?
my second semester.
Okay, all right. You should email me.
Okay, I
All
will.
right.
Because
Okay.
I worked in a pediatric clinic for foster care.
Mhm.
So yeah, and then my last question, I will email you, yes. My last question is, since I'm a current student, the application fee is waived, is that it?
Well, currently, I think the application is waived until the 7th. I mean, until what date? Wait a minute, I wrote the date down, the 7th of April.
Oh, okay.
So, yeah,
Perfect.
and I think it is waived for you, but time is money. So, I would say to you, the big takeaway message for all of you, no matter what program you apply for, this is the time to start to apply. Just
I have, I'm
Yeah,
sorry, I started the process. So I'm just waiting for one of my professors from the first semester. I had asked her for a recommendation letter. I did receive one from the nurse practitioner I worked with at the foster care agency. And I still need to have my personal statement read, edited and look for mistakes. So that's my.
I would tell you to get in touch with me, only because I'm the nursing ed advisor. I mean, I'll help anybody in the webinar. But again, I am really trying to emphasize the importance of when you apply to graduate school, it's not just focusing on the application.
Okay.
You really need to be, and this I know you all know, that a baccalaureate prepared nurse is a generalist, right? You took all those specialties and then somehow selected, went for a job, and then developed a specialty. But you could start off in med surg and in 2 years decide to do peds. There's nothing restricting you because you have a generalist education and preparation, which is great. It certainly was great for the COVID crisis. You would say that too, right? But on the flip side, when you're applying to graduate school, you have to be very, very careful that you are applying to the graduate program that offers the area you are interested in and the specialization.
Okay.
I am a medical doctor. I would like to get a nursing degree. How do I start CUNY? My goal is anesthesia. So, Vanessa, can you unmute yourself? Are you currently a nurse?
Hello.
Yes.
No, I don't have any degree here in United States.
Okay. So my suggestion, but you are a physician in another country, correct?
Yeah.
So my suggestion is to look at, because the focus of this was graduate program application. My strong suggestion for you is to look at accelerated baccalaureate programs that will review your transcript and see what courses would be able to be applied to a baccalaureate degree. There certainly are even accelerated programs that are BSN to MSN to DNP. Again, in New York, it is an issue with that they're limited to NPs, but there certainly are online programs outside the country. But I would say to you, they'll refer to it as accelerated degree, with a prior bachelor's. And you're a unique case where you really should reach out to the admissions of the schools that you're interested in and speak to an admission advisor, because there's a lot of logistics in terms of international transcript review and pieces that may take a little bit time so that you can get the best fit. For the nurse practitioner, for the nurse anesthetist, as you mentioned, you certainly then can look at what the options are to go from a BSN to a DMP or to a PhD. I am not aware of any programs that would take you from undergraduate to a doctorate as one seamless program. But I would start off looking at accelerated NP programs, and it usually has the connotation that it is with a degree in another field. How can you reach me? How can you can I'll type my email in the chat, okay? We need graduate prepared nurses, dear. So that's why I'm here. Yeah. Oh, thank you. You did it so fast. Okay. From Tamika, what programs offer the FNP program? There was one at Lehman that is the one that I know that I think is under review. Currently, I do not know any CUNY programs that have FNP. So again, you can explore the websites to see. I may be missing it. I did review the websites before our presentation today and didn't see any specifically for an FNP. I saw a question. You should use the CUNY First application, the one that is was pictured on the slides, and then select the school that you want to apply for. If you're looking at Hunter, go on to Hunter's website, and then you can select the application process and it'll take you to CUNY. Same thing for SPS. But again, remember, pick the program that you're interested in first. As I hope that this will support some of the decision making, and would say, you know, after doing this for a long time and having a long career, the time is now. There is expansion of advanced practice nursing roles, and it is not limited to nurse practitioner specialties or nurse anesthetist or midwives. But in order for us to really have a place at the table in the decision-making, graduate education supports those roles. So I can't emphasize the importance of that. And think about that, not just now, but in the next 2, 5, and 10 years of your career. And I think that will guide your application to be successful. I did post, or Ryan posted my email, so certainly you can contact me. Ryan now just posted the information on the slides. There is a general SPS CUNY nursing email if you want general questions. And there is also, we have Facebook. And in addition to that, I'm more than happy to respond to individual emails concerning your graduate nursing application plans or trying to make decisions. So again, I thank everybody for their attendance. It was great. I'm really happy that so many people did attend. I can't begin to say how good it makes you feel. And I wish you a good night. Thank you.